morning, Commissioner's Office. This is Patty.
Hi, Patty. I would like to know how much Bonner County has paid out for 2009 for medical expenses for indigent people.
Okay, just a moment. Property taxes that get paid, $496,070 goes towards indigent from property taxes.
And could you please give me the total amount paid in 2008?
325 613.18.
Republicans say it'll cost $1.2 trillion over 10 years for this healthcare system. Okay. Well, other than just throwing numbers at people, why not look and see how much money we're paying without it? My friend and I decided to do a project. We called the county where he's from, which is up in North Idaho, which has 20,000 people. We called them and asked them how much money they've spent in 2009 on indigent people's emergency room visits. Indigent people are people that don't have health insurance. So, those people's emergency room visits, the people that don't have health care, are paid for by the government and taxpayers. So we called this county and asked them how much money they've spent on indigent people's emergency room visits in 2009. They said $500,000. Okay, $500,000 on a population 20,000 county. And there's 300 million people in the U.S. So if you take 300 million and divide it by that 20,000 people, you'll get 15,000. So you go 15,000 times the 500,000 that we pay on each group of 20,000 people, and it equals out to $7.5 billion just in 2009 for people that don't have health care insurance that go to the emergency rooms. That's out of taxpayers. Now, the Republicans said it cost $1.2 trillion in 10 years. So $7.5 billion times 10 is $75 billion in 10 years. So the amount they're paying is going up each year. But the thing is, when we called in early November. So 2009 wasn't even over yet. It had 2 months left to go. So, when you factor all that in, there's no telling how much we're paying on just emergency room visits for people that don't have health care in 10 years. It could probably easily go as high as, half of the $1.2 trillion that Obama is supposedly going to spend on this health care bill. And like I said, that's just emergency room visits for, a county where, a lot of people in the county work. There's a lot of people with money in the town, and a lot of people have health care. And when you take like a big city like LA, you got so many more factors. You got, air pollution, you got smog and everything, which gives people asthma, lung disease. It could even give you cancer and, stuff like that, sends people rushing to the emergency room a lot more.
Oh, hi, is this Senator Risch?
Yeah.
I called earlier about Obama's health care reform. I'm actually doing a project now because I wanted to do a little investigation, a little bit of research. So I'm from Bonner County. It's in northern Idaho. So I called the county commissioner's office, and for 2009 so far, for medical expenses for indigent people, we've paid $496,070, and that's only for 2009. And for 2008, the figure was $325,613, and that was for 2008. There's a little over 3,000 counties in the United States, right? And so the letter that I received said from the last amount from the Congressional Budget Office, $1.6 trillion, right, for Obama's health care. And everybody goes, oh my God, that's a lot of money. Well, just for the heck of it, I went and did $500,000 times 3,141 counties. That's how many counties are. I haven't added personal insurance. I haven't added or deductibles into this amount. I'd like to know why Senator Risch says that debt's getting passed on to our children. Because who's paying for that debt right now? I mean, if you go in Idaho, it's through property taxes. Do you think those thousands of people with property, I mean, the people that are minimum wage jobs, they're not paying this. But people in Idaho with property that are paying this, do you think they enjoy paying this much money? When if we had healthcare reform, that amount would be lower and everybody would be covered. These are official reports from the commissioners. That's one county of about 40,000 people is $500,000. So why does he say 1.6 trillion? Again, that's from the Congressional Budget Office. That's the last thing. Why does he say that's going to be passed on to our grandchildren? Who does he think's paying for the current deficit right now? He didn't do the figures. So I'd like to know if, number one, if he's done those figures for Idaho. I'd like to know if he has counted up for 2009 every county, the 44 counties in Idaho, if he's counted up the medical expenses for indigent people for 2009 and tallied those all up. I'd like to know if he has done that. And number two, I'd like to know if he's thought about all the counties in the United States, all the amounts those counties have for 2009 for medical expenses for indigent people and added those up.
I can pass your message on.
Because I'm 21 years old, and I'm basically just a normal person. You know, I graduated school, I turn on the news, and I see, and I'm like, wow, 1.6 trillion, that's a lot of money. But I'm thinking, what are we currently paying, right? Because nobody, CNN, Fox, nobody, MSNBC, they don't break down really what we're currently paying. I mean, it hasn't come across to me, and it hasn't come across to my friends. So when I add these numbers, I mean, even speaking with you on the phone, I don't know what your views or whatever you think about healthcare reform. But I mean, if I lay these figures out, and they're true figures, you yourself can go to Google, you can type in each county assessor, you can just call them and they give you the figures, and you add those up. It's black and white, it's right in front of you. I mean, what point of that does he miss? These people that own property, why do they want to pay more money? They don't understand because nobody's laid out the facts, and that's on Rich's error. Because that's, why pay all this money if you don't have to?
All right, I will pass this on to him.
Okay, thanks.
You're welcome. Bye-bye.
Now, the reason Idaho is such a great state is, number one, it's Republican. Number two, it's conservative. Number three, a large part of it is rural. And a lot of the people you're hearing about who oppose health care reform are from rural areas. And I believe, if you check it out, that Idaho has one of the higher non-graduation rates among high schools in the country. I could be wrong there, you want to check it out, but that they used to rank at the bottom on high school graduation rates, okay? So misinformation targets people who are uneducated and therefore uninformed and more susceptible to easy, understandable false info. So if I come in and I say, this health care reform bill is going to settle future generations with trillions of dollars of debt, and I leave, people like that are going to go, wow, trillions of dollars of debt, health care reform is evil. In Idaho, those counties pay those indigent sons off of tax revenues. And my understanding, and again, you should confirm this with each commission you talk to, okay, what you can do, is that property owners are taxed additionally to come up with that money. And if they're not taxed additionally, then it's taken out of general revenues, which in fact are based on property taxes, okay?
It's a good bill, and it highly benefits the public. So, I mean, ask yourself, who would oppose a bill like this? Insurance companies. Who would a bill like this hurt? Greedy insurance companies. Who would a bill like this help? The public. Who would oppose a bill like this?